Health, we have Dental Director Katie Thornton and Dental Manager Erin. Welcome to our show.
Good morning.
Thanks. Good morning.
Big Center for Family Health complex, the campus. Half of it is the dental clinic. It's a pretty big part of the Center for Family Health, isn't it?
It is, very much so.
So you guys have a new sensory, is it operatory room?
It's both.
Both? Yeah. Tell us a
Yeah.
little bit about that.
Yeah.
What does that allow for?
Yeah, so these spaces have come out of some pretty exciting work that we've been doing over the past year in the clinic. We've been working on a project funded by the Delta Dental Foundation to increase access to dental care for individuals with intellectual and developmental disabilities. So developmental disabilities include conditions like autism, Down syndrome, cerebral palsy, and others. And unfortunately, the reality for many families of patients with these disabilities is they face a particularly challenging time finding a dental provider for their loved one. That's been a long-standing problem, so when the opportunity came up for us to work alongside other health centers to address the issue, we jumped at it. And so several of our staff, including dentists, hygienists, and assistants, have gone for 3 days of immersive training at centers that are devoted to the care of individuals with disabilities. And then to complement that training, a company called Sensory Health recently came into the clinic and built us a new sensory room and then modified 2 of our dental operatories to make them more sensory friendly.
That's great. That's going to be obviously wonderful on the patients, but it probably helps the staff quite a bit too.
Absolutely, we love it. Yeah, it's been noticeably different, calming, and I think that subconsciously translates to our patients.
Erin, do you think there are families that just don't do the dentist because it's just too stressful for the child?
Absolutely. I think, even beyond that, adults, you have adults with past experiences that were negative, and so child or adult, it is great to come in there and very calming, and the staff's very welcoming, and gives them a lot better experience than what they might have.
And Erin, your oral care and dental health is so important to your body's entire health. Missing and skipping out on the dentist for years at a time is not a good idea.
No, it's not. That's what I hear from our dental director, but absolutely not. So we want them to come into a welcoming, comforting environment and not skip that care.
We actually have some photos of what the new sensory room looks like. Well, lighting, that's your first clue that it's different.
I like that immediately because it's darker.
Yeah.
I love that.
Yep.
Right.
I think that might be one of the most calming things about it is walking in there and it's just not bright lights and it doesn't look, like a sterile
Right.
bright light. But yeah, even our staff go into that sensory room and can just kind of calm down for a little while or go in there on their lunch and really enjoy it.
Katie, what's common that you see amongst your patients? What do you guys see a lot of emergency services, a lot of teeth pulling? What's very common?
Yeah, we do a mix of things. So we provide comprehensive basic dental care, which does include extractions, but also fillings, partial, complete dentures. We do see a fair number of emergencies, unfortunately. That's a huge need in our community.
Do people just wait until they can't take the pain any longer and then that becomes an emergency?
Correct, yeah.
Yeah, it's pretty cool. That sensory room has a disco ball and prop sunglasses.
Yeah,
so
it's cool.
The idea, they'll want to come back. They'll look forward to the visit.
Hopefully so. And I think we're seeing that. And we served 6,500 patients both in 2021 and 2022, and last year had just over 14,000 visits. So we are seeing people come back.
So people really, they need to call to make an appointment on dental services, and sometimes it's probably the first time they're seeing you. What do you recommend for a potential patient? Call, speak to someone, and then try and schedule an appointment?
Right. So if viewers are in that situation where they've been struggling to find care for a person with an intellectual or developmental disability, we suggest that they call our office and let our front desk staff know that is their situation, and that way we can.
And I'm sure every dentist can tell you, oh, we have patients, they come in and it didn't go well and they never came back, even though they should have.
Right.
So do you have to if you're a parent and you've been, to 4 or 5 different dentists and things just haven't been working out because of the fear and the anxiety and everything, is that an appropriate patient then for the sensory rooms?
Absolutely, yeah. And we've already been, we've had them for a short time, and we've been using these spaces and finding that it's providing a better experience for people.
I like how you've actually trained your staff. You went away for a few days to get trained.
Yes.
What did you learn as care providers? What you had to do differently, or what are the new skills that you learned in dealing with these types of patients?
Yeah, that's a good question. So there's many things from the beginning of the process, even before the appointment, where gathering more information about the individual and what maybe some of their sensory needs are, whether they're sensitive to light or noises or particular tastes or scents, those sorts of things. If we know it up front, then we can try to accommodate them. And then, going through the visit itself, I think it's really taking time to listen to the caregiver or parent about what their experiences have been, what works well for that individual, trying to, be flexible with our visits. So we've actually had to take some folks into the sensory room to do an exam or apply fluoride varnish there. And then there are other techniques with sometimes if a person has certain behaviors, stabilization might be something that we consider, and so we learned those techniques at the centers. It was a really comprehensive experience.
How important is it for parents when they're with their children to not show so much anxiety themselves, so it's not as bad on the kids? But parents, and maybe like Bart said, you've gone to a few places, so you're worried about your kids, so naturally you're going to have some anxiety. But that is pretty important.
It is. They could have had a traumatic experience before in their dental history. So, I think making everybody a part of the visit and making them feel calm is very important. And we certainly want to.
And it's obvious that the care that you provide using the sensory room, it's extra time. It's going to take a lot longer. And as busy as you guys are, it's neat to see that that's a willing sacrifice that you're making in order to give people the time they need.
Yeah, absolutely. Our dentists are fantastic, and Dr. Thornton's always great. She mainly sees children at our clinic and does a fantastic job. Very patient, very kind. Our patients love her.
I can't believe how busy you are. That's
amazing.
A lot of patients, 6,500.
Just on the dental side.
Just on the dental side.
Amazing.
Yep.
Amazing. Yep. So what are some type of emergency services that people should call for and try and get in right away?
Certainly if they have a facial swelling.
Okay.
That is an emergency and can become serious for people. So they should try to find a dental provider, and if that's not possible, if an office is closed, for example, it's after hours, we do have a walk-in clinic at the center that can also see patients with those needs.
Pain. Is there anything worse than dental pain? Tooth pain?
Probably not.
Not much.
No.
Probably not.
Pain would drive people to call.
I think pain. Yeah. Pain. Can't take it anymore, right?
Right.
You probably see people that are ready to pass out from the pain in some cases. I mean, so.
Well, we'd rather they get care before
Yes.
that point.
Of course, yeah.
Yep, but we do have them call and we do try to accommodate as soon as possible and get them out of pain, get them comfortable again.
Nice. Erin, how long have you been at Center for Family Health?
This is my 16th year.
Oh my
Wow,
gosh.
that's amazing.
Yes.
Awesome.
Started when I was 10. It's been a great experience and love it, and just love our mission and helping the community. And
That's great. How about you, Katie?
Nearly 8 years.
That's
Yeah.
awesome.
It's flown by.
Yeah, it's great.
Amazing. Before Center for Family Health, who knew what people did?
I don't know what people did.
I don't know what people did, but they probably forwent care, forgoed
had
care.
foregone.
Had forgone.
I like that.
Sure.
Yeah, I like had foregone.
They just didn't go.
Yeah.
Yes, they didn't.
Well, thanks so much for coming in, and thanks
Thanks
to
for
the
having
Center for
us.
Family Health for providing this awesome new service for patients with special challenges.
Thank you for
Thank
having
you.
us.
Thank you, guys.
Katie Thornton is Dental Director, and Erin Toom is Dental Manager at the Center for Family Health. More of the show. Stay tuned.